Our service includes, among others, a heroin prescription program, including currently 60 patients. We hope in a short time from now 70 patients. Really, it's a really successful program. We were able to largely reduce HIV infections to let survive our patients, to reduce largely illegal drug consumption, to reduce delinquency, finally to reduce all those negative effects that illegal drugs can have. The problem we have now is that instead of needing to make survive our patients, we need to find some reasons for them to live. That's really another issue. We were successful to reduce mortality. Now the challenge is what to do with our patients. You have to know that usually our patients remain in the program several years. We have even some patients that were there when we opened our program more than 20 years ago. So instead of having young, critically ill patients like more than 20 years ago during the open scene period, we have middle-aged or even older patients. The most old patient is more than 70 years old. So you see, the issue is completely different. We have to think about, with them clearly, what could be a good life for them instead just to think how to make them survive. To have the courage to start, there are not really great risks. One of the most heard fears are that consumption will increase. It was not the case in Switzerland. It even for mainly for opioid, we even observed a small decrease of consumption. The second fear was that it would attract dealers around the facilities. For Geneva, there has been a study around the injection room, who showed that criminality, even small criminality, decreased in the neighborhood. It may increase elsewhere, but it decreased around the facilities. I can also say for our institution, for the heroin prescription program, we seldom see dealers or other problems around the facility. But for that, you have to integrate it in the neighborhood. There is some work to do with the neighborhood. And what we were always astonished about when we changed our location, as it is really rapid as normally the neighborhood accepting and adopting even the institution. You have to know that drug users are people. They can be nice, they can be nasty as every other people, but often if they are accepted in a neighborhood, they are nice, they are helpful. They have dogs, they can talk with ladies and so on, and they can have a role also in the neighborhood. It has to be prepared, but it is clearly possible. Yeah, we have several models in Switzerland, so we can clearly answer the question. We have some injection rooms and heroin program which are located really near, some meters from emergency rooms, and we have other models like in Geneva where the facilities are far away. The injection room is far away from the hospital, and there wasn't never a severe overdose. There are overdoses, but workers, the colleagues in the facility are trained to manage that. Then in the heroin prescription room, you have to know that in more than 22 years now, there hasn't been one fatal overdose, not one, never, ever. There were several thousands of patients treated in that room, not one fatal overdose. Sometimes we have to adapt the dose because patients possibly consume also still illegal drugs, but really it can be managed. It isn't sometimes even easier than with other opiates like methadone.
Thank you very much.